I'm your host, Dr. Jack Braha, and welcome to another episode of Medcast Plus. On the show, we feature local healthcare providers and physicians to educate us on various medical conditions and provide us with some very helpful health tips. Today, we are really honored to have Dr. Sos Nalghranyan. He is an oncology fellow at Brookdale University Hospital here in Brooklyn. He has an interesting story to tell about himself and coming to America and his research and his education leading to becoming an oncology fellow here in Brooklyn. Sos, as you asked me to call you, Dr. Sos, Dr. S-O-S. It is a pleasure to have you on Healthcare Plus. Welcome.
Yes, nice
welcome.
to meet you.
You know, for our viewers here today, Dr. Nalghranyan, tell us a little bit about yourself. I know you weren't born here in America, but tell us your American story and how you got here.
Yes, absolutely. As you already introduced me, my name is Dr. Sos Nalghranyan, and I am a hematology oncology fellow at Brookdale University Hospital at Brooklyn. I am an immigrant in the United States. I moved from Armenia to America in my 20s. So what's really unique about this move is that I have had the pleasure to work in different parts of the United States, practicing medicine from West Coast to East Coast to South. And that from that experience, I've had the pleasure to provide care for those that needed it, but also learn about American culture at different geographical locations. So I worked 2 years as an internal medicine hospitalist before I decided to advance my career into oncology. And I'm here back to New York, and I'm very excited about it.
Yeah, we were talking about your travels across the country. You went to medical school in Armenia, and then you went to the West Coast first?
That's right. So basically, I have started my early career in West Coast working in hospital administration, and then did my residency training back in St. John's Episcopal Hospital in Queens. Afterwards, I've worked actually a year as a hospitalist in Southern Medical Foundation in Sacramento, and then a year at the University of Arkansas at the Myeloma Institute at the bone marrow transplant unit. And then eventually, when I got a position back for a fellowship in New York, I actually moved back this year to New York for advancing my career into a specialty.
So now you're back in Brooklyn, where I know you've always wanted to be.
Basically, yes.
Make our viewers happy,
correct.
our Brooklyn viewers
Yes,
watching
Brooklyn.
today.
Mm-hmm.
And you're at Brookdale University Hospital, a huge institution here in Brooklyn, a hospital with a great history, lots of beds, lots of patients, lots of doctors, nurses, ancillary staff, a local trauma center, a major institution here in Brooklyn. And it's got to be such an honor to come and train at such a great place in such a great county.
Absolutely, absolutely. I'm very excited to be back. I like New York. I think it's the capital of the world. I like the diversity of the New York, the diversity of the patients that you treat. And I think currently in my list, I have patients from Southeast Asia, Africa, Europe, Russia, Latin America. So I think it's a great strength to actually treat this diversity and be helpful as much as I can.
Yeah, it is true. I'm originally from New Jersey. I came to Brooklyn at some point during medical school and realized that this is the best place because you see everything. We have such a melting pot here in Brooklyn, people from all over the world. And it's also nice because we have doctors from all over the world. It happens to be a place where many people land, coming from other countries to come here, train, learn, and then practice. We were talking a lot about your background, and how did you end up going through all of these different institutions and after medical school in America? How did you end up wanting to go into the field of oncology for our viewers, which means the field of cancer care?
Right. So I found the role and the purpose of my medical career into being a specialist, particularly for oncology. I think transcending the diagnosis of cancer for the patient and the families, it's a very rewarding experience, basically, to actually treat and
it's a challenge, really. Cancer care is, to me, I mean, that's why I didn't become an oncologist.
Right.
I thought it was, too much of a challenge. I thought it was really
Right.
sad. And I know that we've interviewed a number of oncologists here, and you guys are a different breed. You see the
Right.
opportunity here.
Yeah, no, absolutely. I think treating cancer is challenging, but if you like the challenge, please go ahead for it. And I think I actually like the challenge. And I think the fact that I do not surrender to cancer, and in fact, I actually fight with my patients in every step of the way. So I think defines why I chose to become an oncologist. I like what I do, and it makes a difference, and it matters.
Yeah, it sure does. As a gastroenterologist, I'm always trying to put you guys out of business by finding colon polyps when I do a colonoscopy and removing those so that people don't end up with colon cancer. And I know that my breast imaging friends are always looking for little problems on mammograms and sonograms, trying to remove these little lumps and prevent you from having breast cancer business. And our gynecologists are trying to screen for cervical cancer. So you're under our radar. You're in our crossbow, where we would love if you had no business. We would love that if none of our patients had to see an oncologist, but obviously that's not true. And you know, here in Brooklyn we have a cancer problem. We have a high rate of cancers, particularly colon cancer. And I know you take care of every type of cancer right now as a fellow in the hospital. What is your biggest challenge right now? Which cancer that you deal with really bothers you? What keeps you up at night and say, hey, I need more here?
I think currently, just because we work in a community hospital where we do not have a bone marrow transplant unit, I think it would perhaps be the acute hematology-related malignancies where there is a limitation of cases where we will be able to treat at Brookdale. So the cases that are in acute phase, we might have to transfer them out to tertiary medical centers for bone marrow transplants. So I think cases with acute myeloid leukemia or chronic myeloid leukemia in accelerated phase, things like that nature would be probably the most challenging ones that you'd have to actually transfer the care to a higher level of care for a bone marrow transplant, basically.
I'm going to translate that for our viewers a little bit, because I know a little bit about the blood cells. I mean, at one point during medical school, I looked under a microscope to learn this, but you know, for our viewers, there are certain cancers of the blood cells, which all of a sudden you produce a ton of white cells, which are the cells that normally fight off infections.
Right.
And so the body is producing way too many cells, and that can manifest it in many, many different ways. And when they arrive at the hospital, they require urgent care. So, you know, at many hospitals across this country, you can't provide that type of care. They have to be transferred to a major cancer institute sometimes. Yeah, I hear that challenge. I think any of us that work here in New York City or at other hospitals around the country, there are always going to be certain diseases that we just don't have the facility to treat, and we as fighters in disease wish we could take care of everything. So there are those days where you have to say, okay, I got to phone a friend or transfer a patient. As we were saying, you treat all different types of cancers. Solid tumors are the tumors that affect.
I mean, as a fellow, currently we treat every kind of cancer. You know, we treat without any differentiation. If it gets to a level where we need a second opinion or it's a very complex case, we always have a second opinion from bigger centers. But
like kidney cancer, you're treating colon cancer, liver, right?
Yeah, all kinds of solid malignancies.
And then we talked about the blood cancers,
yes.
Right? So there are two different liquid cancers and solid cancers.
Yeah.
And so at Brookdale, you're treating all of that, and you're a fellow, so you're in the heat of everything. You're the first person to often see the patient, and then you know, you go back to the attendings, the people on service. You have conferences, a lot of learning going on.
Yes, tumor boards, conferences, and a lot of lectures, you know, on a daily basis. So I think it's a great education, especially being in a community hospital where you have so much hands-on experience. You know, I think I'm more of a practical and a hands-on physician, where I actually really value this experience that I'm getting at Brookdale. I think it prepares a very hands-on and a great prepared physician.
Right, and
for the future.
When we talk about cancer care, there's not just the oncologist. I know you probably work in a team, and we've talked on this show before about, you know, tumor board. And for our viewers, that means that when you present to a hospital with cancer, God forbid, and say you have a kidney cancer, there'll be a meeting after the doctors see you where all the doctors involved in the care sit in a room with many of other colleagues, scientists, pathologists, and they will go over your case in particular, and it becomes very, very personal. All the doctors go over the case. And tell us a little bit more about Tumor Board.
So basically, cancer care is a teamwork between a medical oncologist, which is who I am, and between the remaining of the specialties within the cancer multidisciplinary team. This includes our surgical oncology colleagues. This includes our radiation oncology, social work, case management, and also a palliative team if needed be. So each case is very individualized to the patient needs and wishes, and every case is very different and unique based on the staging system. So therefore, the meeting where we discuss the tumor board cases, you know, brings up the general consensus of how to proceed on most complex cases that we see sometimes.
Yeah, we see that quite a bit in our practice where, we'll take a complex colon cancer case, might have spread somewhere else in the body, and, we get involved with the other team members, we meet, we go over the case for hours at a time where we try to put everything together, not just the disease, the social aspects, the patient
Exactly.
wishes, religious wishes sometimes we deal with quite a bit. And, as a fellow in oncology at Brookdale University, I'm sure that you're in the thick of things there.
Yes, absolutely. Yes, yes.
So tell us a little bit about your future. What are you planning on? What's the next step after you complete your fellowship?
Right.
All these years of medical training, now you're,
Yes.
they spit you out and say, go practice.
Yes.
Where might you be heading?
I haven't decided where I'll be practicing, but I'd like to see myself in a growing oncology practice where I actually make a difference every day. Again, it'll be a bit immature to make a decision right now and say I'll be practicing at X location versus Y, and it also depends a little bit on the family dynamics and etc. So, but I would like to see myself in an oncology hands-on practice where I actually bring a change in every day of my life. So that's why that was a calling for me to become an oncologist, because I strongly believe in what I do, and I like to fight with my patients in every step of the way.
Yeah. So for our viewers, we're here with Dr. Nalghranyan, who is an oncology fellow at Brookdale University Hospital. We've been talking about cancer care here in America as well as in his homeland of Armenia. And one of the topics that comes up often with doctors is, what do you do for fun? What do you do outside the hospital? Because what we do is stressful, especially cancer care. Fighting cancer is a challenge.
Absolutely.
Where do you go for fun in New York? What restaurants do you like? What parks do you go to? What do you do for fun to get your mind off of things in this stressful world?
Well, I think exercise is very important. I think it's part of my lifestyle, and I think that's one way to actually relieve the stress and remain focused. So I've been doing a variety of things, from gym to swimming, into recently started kickboxing classes, which I really enjoy. So I like nature. I like Central Park. I like a variety of restaurants that we have, particularly with Mediterranean food. So there's always things to do in New York. Always.
Yeah, New York is a 24/7 city, and you're working at a 24/7 place at Brookdale University as an oncology fellow. We talked about what you do for fun outside of work, and that's very important because as physicians, we see a lot of burnout amongst our nurses, amongst the physicians. And I respect all the oncologists in the world because I personally couldn't do it. I find it very challenging and depressing, and you see the good part because you get to treat it.
Right.
What do you feel about physician burnout? This term where they feel that we've become depressed, anxious, lack of sleep.
Right. I think we all have this burnout to some degree, and I think oncologists more so, because yes, indeed, we do go through a lot of stress, and I think one way I personally deal with it is I always try to focus my mind into the positives, because there is just no other way to practice oncology. My other thing that really helps me to stay focused is actually the physical activity and exercise. Again, I make it as a habit 3 times a week at least, to keep myself busy and do the physical activity that helps me myself be focused. I think the other important aspect that I've noticed for keeping that burnout at the lower pace is to actually be honest with a prospective employer and bring up your limitations and your limitations and your capacity in terms of providing the high quality of care to your patients, and say, this is the maximum number of patients that I could see on a daily basis, and I won't be able to do anything more than that, basically.
Yeah, I think we all go through that as physicians. We just wish, I think we wish we could see every patient available every day of the week, because that's, we spend 15 or 20 years training to do what we do. Starting off at 18 years old as a college freshman, you have to start early on, and by the time some of us get into private practice or graduate all of our training, it's 20 years of education.
Exactly.
And the reason I bring this up is because also for our viewers today, a major problem in the world, and here in New York especially, with the fast-paced life that we live, is patient burnout and stress management and health, because that contributes a lot to cancer care, is our lifestyle.
Yes.
Right? There's a lot of things in our lives that we do which raise our risk of cancer. Smoking, and why don't we go over a couple of things that our patients and our viewers watching today
Right.
can do in their lifestyle, simple things to reduce
Exactly.
their risk of cancer.
Yes, absolutely. I think that's a very good point, and I think and then my message will be, for the regular patients who do not have a cancer, please stay healthy as you are and continue your primary care visits. Follow the guidelines of the cancer screening for commonly seen cancers such as colon cancer, prostate, breast cancer. That's just remember that. One way to beat cancer is to actually diagnose in early stages, and the way we can diagnose at early stages to detect them in early stages. So that's why the role of the primary care is very, very important in this.
Seeing a primary care doctor as like your advocate, your agent, to make
Right.
sure that all the check boxes are marked off.
Yes.
For our viewers, you can go to the National Institute of Health, cdc.gov. You can go to some of the government websites, American Cancer Society, to figure out what you need to be screened on based on your age.
Right.
So that's one way to prevent cancer from starting in the beginning, is to screen, or to prevent dying of cancer, is to screen and find it early. Diet, smoking, exercise,
Yes.
weight. Tell us a little bit about these things.
Those lifestyle changes are quite important. I think smoking is one of the biggest, ones that is absolutely, not recommended to anybody. So therefore, it's never late to quit to smoke. So
You can stop at any time and
exactly.
reduce your risk.
Yes, anytime. Quitting smoking at any time will reduce your risk of lung and many other cancers, actually bladder and pancreas, to a substantial degree. So. Eating, good like fiber-rich, food, you would know more about it.
Salads, fruits, and vegetables.
Yes, absolutely.
Absolutely.
Fruits and vegetables, are very important to actually, decrease the risk of diverticulosis and also substantially, developing the polyps, and that could actually convert into cancer later on. So all those lifestyle changes are quite important for cancer prevention. But also, I wish you never need us, but if you ever happen to need us, I want you to know that you're not alone in this battle, and we'll be, the medical oncologists are there for you, and we'll be fighting with you in every step of the way. I want to emphasize this again, prevention of the cancer is much more important than actually easy than treatment.
As I started out the show saying, as much as I like you seem like a nice guy, Dr. Sos, but it would be my dream that you never have any business.
No, it's okay.
There
I
are
agree.
no cancer patients
That's
out
fine.
there. And so for people
fine.
watching today, some health tips are exercise and diet, keeping
Right.
a normal weight,
Right.
having a diet rich in fruits
Right.
and vegetables, avoiding smoking, avoiding too much alcohol.
Right.
Getting our screenings done.
Right.
These are all available at Brookdale University Hospital, in your outpatient clinics, correct?
Absolutely.
Anybody looking for information can go to the website, brookdalehospital.org, I believe, and they could find a clinic, or they could find a primary care doctor who
Right.
really is your best advocate out there
Absolutely.
to help guide disease.
Yes.
We don't want you to have to see Dr. Sos, but if you do,
Right.
he's a fellow at Brookdale University Hospital, specializing in cancer care. Let's spend our last few minutes talking about the importance of the screenings. Let's talk about first for females.
Right.
What are some of the screening exams for females that they should be going for?
So a routine mammogram starting at age basically of 40 to 50, depending on the risks. So are quite important for detection of the breast cancer. For the females also the pap smears, are very, very
The cervical
important.
exams,
Starting at the age of 21, and then every 3 years and after age 35, I think the guidelines change to every 2 years thereafter. I think those are important.
So seeing the
concepts
gynecologist,
exactly,
getting the mammogram.
right. And
Let's talk about men a little bit. There are
right.
some male viewers out there. Men are the worst patients, I'm telling you.
Right.
We know.
Right.
We wait for our wife or our girlfriend to grab us by the ear and drag us in.
True.
But for men, we have to worry about prostate.
Right. Yes, prostate cancer, the screening of the prostate cancer is a little bit controversial, and I think it's a bit maybe out from the scope of this show, but I think, it's very advisable that you discuss the screening guidelines with your primary care provider and see whether you fit into this.
Right, there are some tests where they can feel the prostate,
exactly.
do blood work. It is controversial, but men should still, who are watching, what age do you think they should get out there, at least have a conversation about it?
Yes, at the age, starting at the age like 55, 60, they should start talking about the prostate cancer screening.
And then for everybody, we know colon cancer affects men and women.
Right.
So colonoscopy, now they're recommending even earlier at age
Right.
45, or other tests like a stool test or a virtual CAT scan.
Correct.
One last thing that we always want to talk about is skin care. Skin cancer is the most common cancer. What's the importance of sunscreen?
Right. It is very important, to use the UV, sunscreens at very hot temperatures, and it's proven to basically decrease the risk of melanomas and other types of skin cancers. So it is very. I mean, unfortunately, these days actually we don't see a lot of, which is great. I don't see a lot of skin cancers, which is
Maybe
very
because
good.
everyone's wearing their sunscreen. They took
And
our
also,
advice.
maybe in New York we don't have plenty of maybe sunshine. Maybe that's why
Right,
also.
right.
But I haven't really encountered a lot of skin cancers as of yet. But again, using sunscreens are one of the core basic concepts for prevention of the skin cancers when it's
Right.
in
So,
time.
so very important information that you've given us today. I think we've learned a lot about you, Dr. Sos,
Right.
your background, your trip here to America, how you've become part of the Healthcare Society here
Right.
in Brooklyn, and your work at Brookdale University Hospital. So thank you for coming on the show. It's really been an honor and a pleasure to have you come give our viewers some really, really important information. Thank you for watching today's show. As Dr. Sos informed us, there are many things we can do to prevent cancer. Whether it's seeing your primary care provider for a quick checkup, or going for a mammogram, cervical exam, prostate, or colonoscopy, cancer is preventable or detectable early, and your best shot at cure is to detect disease early. And so as Dr. Sos told us, wear our sunscreen, see our gynecologist, mammograms, prostate exams, blood work we can do, because cancer is a problem here in Brooklyn and New York, and we are here to help inform you on how you can prevent this disease. I want to thank you again for your interest in our show. I invite you to visit our website at medcastplus.com, where you can find more information. There are tools on the website you can use, or connect with us on social media. You can also call us at 718-510-2103. I'm Dr. Braha, your Brooklyn gastroenterologist and host here at Medcast Plus. Thank you for watching. Stay healthy, Brooklyn.